Now, around 1 billion people around the world suffer from migraines, with women more likely than men to be affected by the debilitating condition. Pharmaceutical giant Pfizer says a study has found that migraines are the second most disabling condition in the world, following back pain. Experts say that addressing migraines promptly is crucial to managing the condition and reducing its adverse effects. Joining us in the studio is Dr. Deeb Kayed. He is an American board certified neurologist, and this conversation is supported by Pfizer in observance of Migraine Awareness Month. Doctor, thank you very much for joining us this evening.
Thank you.
So tell us, what is Migraine Awareness Month? Why is it so important, and what are your main priorities right now?
Of the 1.3 billion people who suffer from migraine, approximately half of them don't even realize they have migraine. Really? They think they just have a headache. And therefore, it's very important to reduce the suffering of patients, to make people aware of what is migraine and the need to see physicians, to diagnose it correctly, to make sure you don't miss some serious underlying conditions, and to get the appropriate treatment early. Because if treatment is delayed, the condition can progress into a severe form known as chronic migraine, which can be extremely debilitating.
Okay, so take me through some of the details. How do we differentiate between what is a bad headache versus a migraine?
Okay, so a migraine is, simply put, it's a headache that lasts between 4 hours and 72 hours. It is usually unilateral on one side with a throbbing or pulsating quality, but can also be on both sides. It is usually moderate to severe in intensity, and it limits your activity. So people with a migraine headache don't want to be moving around. They want to sit still. They want to lie down. They don't want to try to go to sleep. Associated with the headache should be nausea and or vomiting, and sometimes as well light and sound sensitivity. This is how we make the diagnosis of migraine. Now, there are many other serious causes of headaches, and if you have a new onset headache, if you have worsening headaches, then it's time to see your physician to try and make that determination.
Okay, so severe pain, anything that seems a little bit out of the ordinary, it is advised to go to your doctor. What are some of the common misconceptions we often see around migraines?
So many of these misconceptions. People spend months, years before they get the right diagnosis. They go to their other physicians where they get told that they have sinusitis, or they get told that you have neck problems. So they spend time and money and effort with physiotherapy and neck massages. They spend time with various puffs into the nose and antihistamines, all to no avail, because the problem is migraine. It's not any of these other problems. How
are these misdiagnoses happening?
I think people are always looking, why do I have a headache? It's a logical question. 85 to 90% of headaches do not have a known cause, and migraine is a very common cause of headaches. There may be triggers, but we don't know the cause. But people want to look for that cause. It must be my neck, I have neck pain. It must be my sinuses, my face hurts. But migraine very often gives those symptoms. Many studies in the emergency room have looked at patients diagnosed by themselves or by other physicians as having sinus headache. Actually, somewhere between 30 and 80% have migraine. They don't have sinus headache. So these misconceptions come from patient side and physician side, unfortunately, sometimes.
So who is most at risk? I mentioned a little bit earlier that women are more likely than men to suffer from migraines. But are there any particular categories or groups of people who are more likely to experience a migraine?
So women are 3 times more common than men to experience a migraine headaches. But it can happen, and it usually happens in the 20s, 30s, and 40s. But there are children. I had a patient today just tell me that she's had headaches since the age of 4. In 90% of the cases, there's a family history. A mother, a spouse, a sibling, a grandparent, somebody else has migraines. So it can hit anybody. 20% of the UAE population suffers from migraine. Usually it's 14% around the world. We have a little higher percentage because we have a younger population over here.
Okay, so family history is obviously key as well. Why is it that women are 3 times as likely as men to suffer from migraines?
Nobody knows. We know there are hormonal influences. We know that before puberty, boys and girls are equally affected by migraine. But as soon as puberty hits, it's 3 times more common in women than in men.
So what would be your advice to help people who are suffering from migraines, or to assist their loved ones who are also dealing with migraines? What would be your top piece of advice?
See a physician, get the right diagnosis, see a physician who has an interest in headache. We have several headache centers in town, and if you go to a physician who's interested in the diagnosis and treatment of headaches, you will get much further than if you go to a general physician.
Okay, good advice. Now, Migraine Awareness Month happening right now. Are there any special awareness events, workshops or activities that members of the public in the UAE can take part in?
I think this is the first year we are coming up with Migraine Awareness Month in this country. So events such as this one, I've been to other talks in order to increase awareness and understanding of migraine among the public. Because even if a person doesn't have migraine, if 20% of the population or 14% of the population, then your neighbor has a migraine. Somebody in your household has a migraine. A friend of yours has a migraine. Your spouse, you're bound to know somebody with migraine.
Okay, and how do we prevent this? Is it down to managing stress, quality of sleep, diet, exercise? To any of these external factors try and prevent migraines?
So the cause is unknown, but in some people there may be triggers. So the trick is to try and identify if there are any triggers. The most common trigger is stress, 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 whether it's at home, at work, just life in general. But also irregular eating and sleeping habits, lack of exercise. In about 30 or 40% of people, there are food triggers. That means 60 or 70% do not have a food trigger. So we don't have to go on a specific diet, but we have to look and see if something triggers it, we need to avoid it. Sunlight for some people, the big humidity, weather sometimes can be a trigger.
Well, great advice, Doctor. Thank you very much for joining us and appreciate your insights on Migraine Awareness.
Thank you for the time.
Thank you.